I've talked in other videos about how sacral neuromodulation therapy can be used for treating overactive bladder, urinary retention, and fecal incontinence. I've also gone into detail about how you can choose which type of testing you can have to determine if your response to therapy is appropriate. Today, I want to cover also in detail the choices you have with respect to generators or batteries. Once you've decided that sacral neuromodulation is an appropriate therapy for you, this is one of the more important decisions you still have in front of you. We'll cover this today on the OAB Clinic. A sacral neuromodulation device has two components that can be separated. First, there's the lead, which is the wire that sits next to the nerve. This is attached to a generator, or sometimes called a battery, that controls the stimulation and stores the energy needed for the signal. Until recently, you had little choice about your neuromodulation battery. For most of their history, these batteries were not rechargeable. The battery slowly discharged over several years until it finally had to be replaced. Now, only the battery needed replacement and the existing lead remained in place. But today, rechargeable batteries are available. These new generators have advantages and disadvantages, and it may be helpful in making your decision to review them. The rechargeable devices are still a relatively new technology, so we have limited information to guide us as to which device is best for any individual person. But based on the studies that are available, I can offer some guidance to help you decide which type of neuromodulation device is right for you. The evolution of sacral neuromodulation batteries over the last 20 years has progressed towards smaller and smaller battery size. The goal has been to create a more comfortable and less intrusive therapy. But there's a balance to strike here because as battery size decreases, the capacity and the longevity of the battery decreases as well. Make a standard battery small enough and it simply won't last long enough to be of much use. But with the application of rechargeable technology to sacral neuromodulators, we finally have an ultra small battery that can be useful over a much longer period of time. Rechargeable generators are able to be quite small. The latest device is 80% smaller and 1/3 the weight of the current recharge-free device. The generator is less than 1 inch wide by 2 inches long. Now, there are certainly advantages to such a small implant. Both types of generators are buried in the fat of the buttocks to minimize discomfort. Now, most people won't notice either type of battery, whether it's a smaller or a larger. But very thin patients may not have enough fat to easily bury the standard generator. For these patients, a very small device may decrease the risk of discomfort and reduce the noticeability of it. Now, I think it's worth noting here that pain at the generator site is reported in only about 7% of patients. So the advantage of a small battery may not apply to most people. But if you're very thin or have a history of pain from a previous or current neuromodulator, size may be an important consideration for you. But could there be a disadvantage to a smaller device? It's been suggested that the small size may make the device more difficult to locate. For obese patients, locating even the larger recharge-free device can be a challenge. But one advantage of that recharge-free generator is that you don't really need to locate it except maybe occasionally when you want to change a program or run a check, and that just doesn't happen very frequently. If you have a rechargeable battery, you will need to locate it much more frequently. Now, this shouldn't be an issue for most people. However, for anyone who might be obese, has limited use of their hands, or has trouble reaching behind to where the device is located, this is a potential issue that maybe should influence your decision. Another potential problem might be somewhat surprising. Some people have a tendency to move their generators around through the skin, underneath the skin. This is common enough to have a name and is called Twiddlers Syndrome. This is a funny name for a not so funny problem because twisting the device like that can actually cause it to spin around and the wire can eventually break. It's been suggested that the smaller devices could be more likely to spin in these twiddler patients. Though this is completely hypothetical, it is nonetheless interesting to ponder. An important advantage for rechargeable devices is the longevity or the life of the battery. Recharge-free devices, well, they eventually discharge and need to be replaced, though that can actually be done fairly easily under a local anesthetic. Current recharge-free devices are rated for a longevity of 5 or 6 years at standard settings. Rechargeable devices, on the other hand, can probably be used for 15 years or more. Now, a limit on any rechargeable battery in any device is fading. Think about your smartphone battery. Over hundreds of charging cycles. Does it still hold a charge as well as it did when you first got it? It would be a real problem if your sacral neuromodulator had as much trouble holding a charge after a few years as your smartphone battery. The loss of recharge capacity of the battery over time is called cycle fading. The most recent rechargeable generator, however, is essentially immune to cycle fading because it does not use a traditional lithium-ion battery. This new rechargeable battery technology also appears to resist the loss of capacity that occurs over time, independent of the number of cycles. This is called calendar fading. So, at its rated 15-year lifespan, the newest rechargeable devices are expected to show no decrease in their ability to recharge their full capacity. The manufacturer makes no specific claims beyond 15 years. However, it's possible that this new generator might continue to function adequately even beyond that predicted lifespan. Whenever I help people to compare rechargeable versus recharge-free devices, I am always concerned that when people hear me say 15-year battery life, they misinterpret that to mean that they will not see the inside of an operating room for at least 15 years. Now, it's certainly fair to say that some patients who have a placement of a rechargeable device will experience successful therapy without a return to the operating room for 15 or more years. However, not all patients will see this benefit, and it's probably fair to say that the majority of patients will not experience completely satisfactory therapy without any further neuromodulation procedures for 15 years. The first issue is that there's just so much that can happen to a patient over a 15-year treatment period. As you age, you may have changes in memory and thinking that would make it difficult for you to remember to charge the device on a regular basis. You might be able to easily place the charging pad over your device at age 70, but you might have more difficulty at 80 or 85. And if down the road a rechargeable device no longer makes sense for you, switching to a recharge-free device means another trip to the operating room for placement of a new lead as well as a new generator. Though a rechargeable battery may last for 15 years, a sacral neuromodulator includes both a generator and a lead, and issues other than simply running out of charge can occur with generators, and problems can arise with the lead. In a study of over 300 device implants, 38% of patients had to undergo a replacement of the lead at an average of 7 years. The same analysis also found over the same period of time, 39% of patients had dropped out of the study for various reasons, including device infection, malfunction of the device, or lack of a response. So, while a generator that will last at least 15 years sounds like the only choice, many patients, unfortunately, will not see the full 15-year benefit from the rechargeable neuromodulator generator. Now, this shouldn't discourage you from considering this type of battery, but it can help to inform your decision. A final consideration when contemplating recharge versus recharge-free batteries is the amount of patient interaction the device will require from you. Recharge-free devices have sometimes been thought of as a low-maintenance therapy. After 6 or 12 weeks, further adjustment of the stimulation is usually not necessary. Many patients can go for years without adjusting their settings. Now, I'm reluctant to endorse a set it and forget it mindset. While recharge-free neuromodulation may not require frequent adjustments, I always emphasize that overactive bladder, fecal incontinence, and urinary retention are lifelong diseases that require lifetime therapies. Neuromodulation therapy is always more successful when patients and their doctors maintain a continued commitment to additional measures beyond the neuromodulator, like behavioral therapies, diet changes, or fluid moderations. We may spend less time managing the device with a recharge-free battery, but we never stop managing the disease. Regardless of how you view long-term therapy, it is clear that rechargeable devices will always require more patient interaction with the device because they need regular charging. The time burdens for charging are really not excessive, and with the latest device, it's actually able to be charged weekly in about 20 minutes. It can actually reach a full charge that will last 2 weeks in less than an hour. This regular interaction with the device could have varying effects on each individual. I could imagine you might find reassurance and comfort from regularly charging your device. It may give you a sense of control, a sense of empowerment to be an active participant in your own therapy. It could even be a regular reminder to help you stick with those behavioral therapies that can make sacral neuromodulation even more effective. However, I can also envision that maybe you don't want to be frequently reminded of your dependence on this device to control your symptoms. The charging pad for rechargeable devices is convenient and it allows you to move freely even while you're charging, but you may find even this minimal burden to be bothersome to you. The decision to proceed with sacral neuromodulation therapy might be an easy one. After suffering for years with urinary incontinence or fecal incontinence or urinary retention, maybe you're just relieved to have finally found a potentially successful treatment. But the choice whether to use a recharge-free versus a rechargeable battery may not be as simple. It may help to first focus on people who are likely to see the most benefit from a rechargeable device. This would include anyone who's extremely thin, has a prior history of pain at a generator site, or has a desire to be very active in their therapy. You may be at high risk for complications such as infection with generator replacement. Occasionally, some patients will require very high stimulation energy that would quickly drain a recharge-free battery. If any of these situations are in place for you, you probably see enough of a benefit from a rechargeable battery that that's the right choice for you. On the other hand, you may have a high likelihood of problems with a rechargeable generator, or maybe you're unlikely to see any benefit. These situations could include if you're very obese or have limited dexterity with your hands. This would make it difficult to regularly place the pad over your neuromodulator for charging. If you have problems with thinking or memory, or if you're at risk for having problems with thinking and memory over the next 15 years, you may want to gravitate towards a recharge-free device. If you're anxious about frequently interacting with the device, if you have difficulty with technology, or maybe you had trouble keeping up with previous OAB therapies, you may want to avoid a rechargeable device. There are other factors like busy lifestyle or how much you travel, but we're not sure how those should factor into your decision, but you may want to think about them. Choosing between a recharge-free and a rechargeable neuromodulator battery seems to present a challenge, but it's reassuring to remember that in many ways, we're fortunate to even be in a position to choose. For over 20 years, people who wanted the considerable benefits that can come from sacral neuromodulation had no choice. Their only option was a recharge-free device. But our days of having only a single option for neuromodulation are over. Now, patients are free to consider both the pros and the cons of both types of devices and choose the best one for them. This is less a dilemma than an opportunity. Thank you so much for joining me today as we discuss details about how to choose between recharge-free and rechargeable devices. If you learned something useful today, please feel free to like or subscribe to this channel on YouTube, or come to our website at www.oabclinic.com for even more information about bladder and pelvic health. Thank you.